Good evening and welcome everyone. Thank you for joining us for today's webinar. My name is Trupti Pawar and I'm the director at the Indo-American Chamber of Commerce. Today we have organized webinar on COVID-19 and global eye health with emphasis on Indian and American scenario in association with Aditya Jyot Eye Hospital Private Limited, National Eye Institute and Organized Medicine Academic Guild. Before we get started, I would like to request you all that if you have any questions during the presentation, please type them into the question box in your control panel. We will collect these and address them at the end of the presentation. Now, without any further delay, I would request Ms. Rajalakshmi Rao to address the participants.
Friends in US, good morning, and friends in India, good evening. Welcome to this webinar. It gives me great pleasure to welcome all of you and all those participants who have already come in to hear about what you all have to say, organized by Indo-American Chamber of Commerce, COVID-19 and global eye health with emphasis on the Indian and American scenario. I think everybody wants to know what's happening, not just in India, but what's happening in US, because it's always US is the, the research place which brings in the best into the world. And we today have supporting partner, that is Aditya Jyot Eye Hospital Private Limited, National Eye Institute, and Organized Medicine Academic Guild. For the benefit of illustrious listeners, I need to tell about Indo-American Chamber of Commerce. We are completing 52 years of being there. And during these years, we've started 10 branches and we have 2,000 members across the country in mostly industry and various areas, be manufacturing, textiles or, telecommunication, everything. All our members are varied in all these 10 branches. We have in Bombay, Mumbai, Delhi, and Kolkata, Chennai, Bangalore, Hyderabad, and Cochin, Varanasi, Pune, Kolkata. Yeah, I got them all, 10 of them. And so we have a lot of regional work across the country. And this particular series we've started now, and yours is the very first one, is the annual conference series. And this is the very first one we are starting with a bit of a noble cause about giving vision to people and helping people with vision. And that's how we started. And the rest of them are all in banking, insurance, and legal, pharma, various other areas. But coming back to what ISCC does, we normally help all the MSMEs and hold their hand to see that they have all the help with the government agencies and also with any problems with US. And luckily, all the stakeholders, which is our own industry corporates and also the consumers and government agencies, we have a help from US consulate always, and Preeta is the example here. And we have Invest India, who's actually holding our hand through all our programs and giving us the connect with all the departments in the government of India. So that is how we have been doing a lot of work of late. And this is what I have talked about ISCC. And now this one particular one, we have decided to tie up with Dr. Natarajan, who has an amazing background and the right person to connect all of you to this program. And I'm very extremely happy that he's our member and also is a convener of this program. And before I go ahead with anything else, before I introduce him, let me just mention to the participants, we have amongst us wonderful people who are all got together in a very short time to take up this particular cause we've taken. Dr. Gyan John Prakash, Director, Office International Program Activities, Associate Director, NH National Eye Institute at NIH, NEI, USA. And believe me, friends, there has a lot of giveaways for all of you if only you try and connect with him, because he can actually give a lot of grants to whoever are needy in research areas. He will talk about it later, so don't miss anything that he says. Dr. Preeta Rajaraman, US Health Attaché, India and Regional Representative, South Asia, Office of Global Affairs, HHS. Welcome, Preeta. You have been with us earlier and big help for Indo-American Chamber. Mr. Michael Chitun, Fogarty International Center, National Institute of Health, NIH, USA. He is amongst us, and he says he has been in India many, many times, and I'm happy to have him at least on webinar now because he cannot travel to India. Welcome, Michael. We are going to get Mr. Bhuvan Irani at a later stage. I will welcome him when he comes in. And then I go to Mr. Dr. Ravi Goel, instructor, Wills Eve Hospital, USA. Thank you very much, Dr. Ravi, for joining us. And now we need to talk about our Dr. Natarajan, the person who's put it all together, and a man with a golden heart. Dr. Natarajan, his small background I'm giving, and I think you all know, but still for the participants, I have to say this. Dr. Natarajan is awarded with Padma Shri by the President of India. He is President of Asia Pacific Ophthalmic Trauma Society, APOTS. If I just say APOTS, people say, what are you talking? So I have to read the whole thing. And Organized Medicine Academic Guild with 20 medical organizations, that is OMAG. Immediate past president of AIOS, All India Ophthalmological Society president, and President Shankar Netralaya alumni, and Board of Trustees International Council for Ophthalmology, ICO, Secretary General Asian Eye Genetics Consortium, Chairman and MD Aditya Jyot Eye Hospital Private Limited, specialized in vitreous, retina, and macular surgery, and Managing Trustee Aditya Jyot Foundation for Twinkling Little Eyes, that is an NGO. And I have seen over the years, this is of course, I'm just reading what is on his website, I'm sure, but what he has been doing something extraordinary. He's doing from his heart. There's nothing to do with earning anything. It's just with passion to help people. I mean, he has touched 800 million people in slums just on his own without any help, from the government or anyone. And he started having awareness camps, covered 200,000 slums in Mumbai. And actually, he's been sending, bikes with taking photos of people who would not come anywhere, the ladies, women who are, stuck in the slums. He would do all these things. I was like surprised how he's doing so much work. And he also helped people in Kashmir when, when there were this blasts were there and, gunshots and all, a lot of splinters went into their eyes, a lot of children, people, and they had a lot of issues. He especially went there at his own cost and did all that work and came back, helped a lot of them doing surgeries, and brought some people free of cost and kept them in his hospital and treated them. This is a personal knowledge I have because I've seen it. So all these things he does behind the, what we all know otherwise. So that is the goodness of this man. And this particular 2 weeks are supposed to be declared by Government of India as the eye donor donation week or something it is called. And he has convinced Mr. Bhuvan Irani, who believes in such social causes. He's going to join us later. And his thing, he's an actor. He's not a doctor like you to talk about medical subject, but he's going to tell all of us that we should donate and our vision to people who can get some benefit of it. I did some years back when my mother had a cataract surgery, and I know I have donated at that time, and I really would want all of you participants to think of it, not during COVID time, but whenever you can. So with this small introduction of Indo-American Chamber of Commerce, can I now leave it to the hands of Dr. Natarajan to start the whole thing and bring in all our participants, panelists.
Thank you, Raja. Thanks a lot for this opportunity, and thanks. I thank God for allowing me to serve the people, and that's my pleasure. And as you rightly said, serving from the heart. So I will quickly share the screen. So can you see the screen? No. Yes.
Yes, you can see.
Yes. Okay. So, yes. So thanks to Raja and the Indo-American Chamber of Commerce. I'm happy I'm a member of the Indo-American Chamber of Commerce and joined the erudite webinar on the COVID-19 and global eye health with emphasis on the Indian and American scenario. So we have the, as Raja had mentioned, and we have NIH with us, and we have Dr. Ravi Goel, Dr. Jan Prakash, Dr. Michael Cheetham, Dr. Preetham, and Mr. Boman Irani will be joining us. So the glimpse of Aditya Jyot, which we started in Dadar in a 3 flats in 1990, and we moved to Vadala in 2004, and we are the biggest eye hospital in Mumbai. And this is one of the surveys in 2001, and later a few years back by the Outlook, we were ranked number 1 in Mumbai and number 5 in India. And I think that's a great thanks to the entire team. And most important, I am happy is the Reader Digest survey, which is the as a trusted hospital, and it is reviewed by the patients where they say that we can trust the doctors of the Aditya, which is what I every day, and it's there in our vision and mission, where we want to serve every patient who walks in like our own father or mother, and make sure that we work with 100% patient satisfaction with zero error. And this is again another survey. We ranked there, and we also ranked number 1 in the cleanliness of the hospital. And recently, from the Quality Control of India and with the Government of India, we have also registered a program called WASH, where we are training hospitals to get recognized for making sure that it's the COVID precautionary measures done. We have hand sanitizers, dispensers, non-contact thermal scanners, and shields for examining the patients. So this is just to say, I think we have public and we have the Indo-American Chamber of Commerce members who are not doctors, and we are not having. We want to tell that every hospital, the our India Ophthalmic Society, the American Academy of Ophthalmology, giving guideline how to run a clinic during COVID. All of us are working from March end, and I think that's how. This is one of the, I think myself or doctor, we can't recognize people where I think this is myself wearing the indirect ophthalmoscope with the protective gear and N95 mask. It is a tough thing, and we make sure the patient also wears the mask, and that's the clinic, so that we make sure that we protect ourselves, we protect every patient, and we recommend that patient's relative should stay outside unless a small child for some urgent problem, and make sure that you take all precautions. And this is in the operation theater, and then this is the we make where the entire hospital is clean after the patient comes and goes with the disinfectant before starting the service, and you can see our staff. And this is actually, I think, in the our even in our foundation clinic in Dharavi, we do the same. We can see the N95 staff, and where you can see in the small picture where I'm standing in the blue, which is a thick PP, because Dharavi was the problem. And I am glad I'm working with Dr. Ramanan. We are working with this thing called Health Cube, where it's a triage system for COVID, where it will have in the computer the diagnosis which needs new paradigms. So the patients will have the all the detail, including the history, and then whether the patient has this is a health cube which has which we can connect the blood test, we can connect the temperature, we can connect the ECG, but specifically for the COVID, we are actually having the temperature recorded, history, and it will give it has a logarithm which is not AI, but it has a calculation which indicates it is whether it's advisable for the patient to be taken in, or he has a high risk of COVID, and then he has to be referred to a COVID hospital. So this is how, and we can also have the pulse oximeter, so which will which all will be taken and seen what is the risk for the patient also and for the doctor also. So we can have this an integrated instrument, and it's we are working on it. We are already got our ethical committee approval, and we are doing that as a in the entrance of the hospital. So I think with this, I introduce my good friend and he's my brother, who is Dr. Gyan Prakash, He currently leads the international programs and global health and is the international director of the NIH NEI USA, founding president of the Global Identity Consortium, for which I am the Secretary General, and we have Dr. Takeshi Iwata, who's the president of the Global Identity Consortium. And based on this, we had several meetings in Mumbai, Delhi, and various parts of the world. I'm just telling Mumbai because we are in India now. And he served as the first director of transformational medical technology and a pioneer scientific research and product development program. He also worked as a COO and executive vice president at Amateur International, president and CEO of Metastatin Pharmaceuticals. At Pfizer, he served as the project scientist for the largest selling product in the world, the fluconazole and voriconazole, used by millions. And then he earned a master's and PhD in microbiology from the University of Urbana-Champaign, and where even our Raja is done her MBA, and he also earned an MBA and received postdoctoral training in biotechnology at the, and then he medical school in CDC in Atlanta, recipient of several awards and honors in the US, abroad, and include fellowship and AAAS awards. He is the director of the Office of the International Program Activities, NEI, NIH, which is a, and he's a great motivation for me, because we want, as Rajesh started saying, that most of the research is done in US, and I'm happy people like now you will hear Michael Cheetham, Dr. John Prakash, who encourages all of us to do research, and the Indo-American collaboration, which is happening for several decades, signed by both Prime Minister and the President of the federal US, which is, I think, working, and the federal government gives the grant to the, of course, after peer review. Similar thing by the Department of Biotechnology, Department of Science and Technology in India. And I think I'll go over to you, Dr. John.
All right, thank you very much. Let me go to my presentation. Okay, Miss Tripti.
Sir, we could see your presentation.
Okay, great. So, so first of all, thank you very, very much, Dr. Natarajan, for such a kind presentation, and I mean, as well as introduction. You're always very kind to me and very partial to me in most respect, and I admire your energy and admire your work. So let me start out by thanking, first of all, Raja Lakshmi ji, who is alumnus of my university here in the US. So good morning and good afternoon to all of you. And if Mr. Boman Irani were to be here, I would have said a virtual Jadoo Ki Dhappi. You know, he's just, you know, I'm a great fan of his movies, actually. And my wife and I, we make sure that we watch all his movies. So whenever he shows up on the screen, I'm going to do a virtual Jadoo Ki Dhappi. So many of you know where that is coming from, which movie. Most importantly, what we want to do here is talk about some of the information that are very much needed, required, and we all work on these things together. So as you see here, my first the title slide, you know, this has you know, my own background working with Dr. Natarajan and his team, especially in the slums of Mumbai. And some of these pictures were taken from my previous visits. So it's, you know, as Dr. Natarajan said, that, you know, I inspire him. In fact, he inspires, and his team members, Radhika ji and his workers in the slum, they're the ones who actually are the source of inspiration. So thank you all for inspiring us all around the world, what we do in the area of research. And I just want to make sure here that certain opinions that are expressed here are my own and not of the government of the US, and the US government does not bear any direct or implied responsibility for the presentations. So we all know, and since I'm just starting at the first speaker, I have to highlight this actually, according to the World Report on Vision that was just released a few months ago, um, there are at least 2.2 billion people around the world that have vision impairment, of whom at least 1 billion have vision impairment issue that could have been prevented, which is a very, very important piece of information for people like us who work at National Institutes of Health. And so we work with that pretext that, you know, there are a large number of vision related issues that could have been prevented, could be prevented. So 90% of the global burden of eye disease is shouldered by developing countries. Of course, India contributes a huge, unfortunately, huge portion of it. And there are many treatable diseases that go undiagnosed. And there are amazingly number of centers in India that are dedicated or working on this issue. Comprehensive research strategy is needed. International research collaboration in this field is so important because, you know, the sheer large number that actually brings us together with a common goal and interest, and we all have to work together. And organization like the Indo-US Chamber of Commerce obviously can play very important and significant role in building these collaborations. So a wider collaboration is needed, certainly in area of research to advance the high quality science in many areas of vision research. And that leads to the, you know, improvement in standard of care. So let me tell you all about my organization. So the picture you see here, it's called National Institutes of Health. This is just outside Washington, D.C. in Bethesda, Maryland. And it's an agency of U.S. government, very much like Indian Ministry of Health. We call it Department of Health and Human Services, which I and my colleagues who are present here, Dr. Preeta Rajaraman and Mr. Michael Cheatham, we work for the Department of Health and Human Services in general. And the NIH, specifically, the mandate is to conduct and support medical research to uncover new knowledge that will improve the health of all Americans. And here is the highlight: and the human condition throughout the world. So it is in our mandate to actually work and develop new knowledge that improves the health of not only just Americans, but the human condition throughout the world. And the National Eye Institute is one of the 27 institutes and centers that are dedicated to research specifically for eye diseases. So here it is. You know, I've shown you there are many institutes here, 27 of the institutes and center, and National Eye Institute here in yellow. That's one of the institutes. It all makes National Institutes of Health. So in terms of mission, and I work for the National Eye Institute, and our mission is to conduct, support research, and training. Training is a very important part of what we do, not only for today, but for the future, in dissemination of health information and other programs that all lead respect to blinding eye diseases, anything that relates to visual disorders, mechanism of visual function, preservation of sight, and any health-related issue that creates that are requirements for the blinds. So we completed our 50-year just a few years ago, and this mission and program moves on, marches on. And any advanced knowledge of the visual system in health and disease is a very high and the highest priority. We help prevent and treat eye diseases and other disorders, and that in turn improves the quality of life for people of all ages. As you know, if you're born in this world, you know, most people have eye issue, whether it's a childhood eye problem all the way to the aging population. And just this year, our appropriation budget is about 824 million, just dedicated to eye research and training. So how do we view our international collaboration, our international research? Well, we truly believe that global science is interconnected, and we are involved in global eye research. We seek scientific opportunities. We shared, as Dr. Natarajan said, many of the organizations and communities that he's involved in. I'm working with him. We share priorities, support unique presentations in patient populations and opportunities in scientific research. We help specifically the U.S. domestic grantees, people who work, who are the researchers in the U.S. and U.S. universities and institutions when they want to expand in international research, they want to do international collaboration. And we form partnerships with scientists, governments, companies, NGOs, and any organization who wants to do research and training in eye diseases. And here's something I want to highlight, and that anyone from any country, this is very specific and unique to NIH programs, that anyone from any country around the world can apply for NIH grant. And there's a link there that one can look into. So just to emphasize that point, from anyone literally from anywhere in the world can apply for NIH, National Eye Institute Biomedical Science grant to do eye research. And by the way, as Raju Lakshmiji said, that I'm not the one who gives the grant. It's a peer review process. We are supporting the process. We are supporting the organization, and we facilitate the information gathering and information processing. And it's a very peer-reviewed process conducted by very highly qualified reviewers. So now coming to India and Indo-US relationship, the Indo-US collaboration on vision research has been going on for very, very, very long time actually. And you see a picture here. This comes from 2005. And in this picture, you see Dr. Maharaj Bhan, who was the secretary to Department of Biotechnology, Government of India, and the science counselor, Kamal Trivedi, signing a formal agreement on NIH campus on August 24, 2005, with the then NIH director. And that led to evolution and happening of many specific grants, which I list out here. And that started the first wave of a jointly funded program, which we call it NEI collaboration with the Department of Biotechnology, Government of India. And that has resulted into several very highly specific and good programs that have provided not only very academic understanding of eye research and vision issues, but also it has led to many, many programs in applications and use of this information in, not only just India or US, but all over the world. And several organizations from India as well as the US, and some are listed here, have participated in this program. For example, as you see, the key centers like Shankar Nethralaya, L.V. Prasad Eye Institute, Arvind Eye Hospital, the National Institute of Nutrition in Hyderabad, Shroff Charity Eye Hospital in New Delhi, are working with some of our leading institutions such as Harvard and University of Washington University, Cleveland Clinic, Hyderabad, working with Harvard again, and University of California in San Diego, and Shroff working with MIT. And these programs, most of them are actually continuing and are still really producing some very, very high quality work. And Dr. Natarajan knows, under his leadership at All India Ophthalmology Society meeting just a couple of years ago in Indore, many of these this work was presented. And actually, this presented almost every year, some form or other, where we discuss not only just science, but the applications part of it. In the second round of the Indo-US collaboration, we launched two large programs and that related to national priorities in both the countries, US as well as in India. And their programs were in glaucoma and diabetic retinopathy, where our leading institutions like Harvard, working with Shankar Nethralaya, and Cleveland Clinic working with Vision Research Institute, also at Shankar Nethralaya, working on such issues. We currently have the third round of this program ongoing, and it's a very important piece of information that the next grant submission deadline is November 9th. And I would highly encourage you to disseminate this information to not only just to all attendees, but I'm asking attendees to actually inform your colleagues and your peers, everyone that this uh, application is open at this point, and I've given you the NIH link. And this is a very nice program that both the governments have actually jointly funding this. We fund the U.S. Institution and investigator, and the government of India is committed to funding. That's DBT, and government of India is committed to funding Indian or PI organizations. So please disseminate this information. Please inform your peers and your colleagues that this application is due on November 9th. And so in addition to the research programs, the collaborations, we at National Eye Institute, we are also a very large training program. We have been training scientists of pretty much every generation. We have trained a large number of Indian scientists who are who not only made difference here in the U.S. when they were working with us, but a large number, a majority of them, as a matter of fact, have gone back, and they are leading organizations in their respective country. And India, as you can see, with this number of people who have gone back, India constitutes a large number. Currently, we are training a very good number of Indian scientists, out of about 88 or so, the foreign postdoctoral fellow, 15 of them come from India. So this association continues not only in the previous generation, but and the current generation, but also it will follow the next generation, because these scientists, they become really the opinion leaders of tomorrow, and our association continues the next generation. So in terms of final thought, I would like to actually give you a certain takeaway that National Eye Institute supports the entire research continuum, which goes from basic discovery, basic research and science, all the way to clinical trials that is affecting clinical practice. Anything that relates to vision research, we are interested, we are part of it. There are many opportunities that one can actually tap into. They are from mechanistic-based treatments through concerted and focused efforts from basic discovery into clinical application, and that are supported by Indo-US program or individual programs or training programs, as well as the research programs. And since we are in this pandemic at this point, unfortunately, and I would like you to know that NIH is really at the forefront of COVID-19 research in terms of developing diagnostics, therapeutics, and vaccines. And we are all supporting this program, various forms or other. And the National Eye Institute team is looking forward to the opportunity to work with the global organizations, including the Indian organizations, in developing programs to prepare for any pandemics in the future. And we are always very impressed with the enthusiasms of Indian researchers, Indian organizations, that of course includes Dr. Natarajan and his institution, who are supporting this specific program. But in addition, all other Indian organizations who have actually made a big difference in working with the National Eye Institute. Of course, that includes Shraf Eye Hospital, Arvind, LV Prasad, Shankar Nethralaya, and many other the organization in Chitrakoot, and many organizations that are part of our daily life, working with us, and many of the programs. So I want to thank you very much. I like to say that good eye research anywhere is good eye research everywhere. So if you develop something, if you do something really nice, of course the whole world uses it. The US, it gets used in the US. If we do something, we share it with you. So let's continue the good work and the passive collaboration, and we are very excited and enthusiastic about continuing our work with India. So I want to thank you very much. I'm giving you my contact information, and I'm available to actually work with anyone who has any new ideas. Thank you very much. And Dr. Natarajan, thank you very much. This concludes my presentation. I'm open for any question.
Yes, thank you, John, and it's really always great listening to you, and glad you are also part of. You included me in the World Congress of Ophthalmology, which was held where we had about 7,000 doctors from all over the world. That was in June, as part of the International Ophthalmology, where you mentioned about the research collaboration, and you brought scientists from New York and talked about COVID and what's COVID research going on. Maybe I like to have one question. What do you think about the vaccine being developed for COVID? I know it's not exactly the topic which we are discussing. We're talking about eye. And any other question anybody wants to ask?
So Dr. Natarajan, as you asked about vaccine, and obviously, as you know, NIH is really the forefront of vaccine development, and we essentially have our involvement in pretty much all major vaccine programs that are ongoing in the US and worldwide, whether it's Moderna program, AstraZeneca program, Pfizer program, J&J program, and in some way or fashion, not only just basic research, but we are also participating in clinical trials. And our leading scientists and researchers, including Dr. Tony Fauci, who I had the greatest honor of working in my previous life, they are literally the forefront of the world, actually, in working with our government and other organizations. So NIH is very much involved, and these things are happening pretty much daily. And I'm always eager to watch the evening news, the day's development. And I'm pretty sure that with all this hard work people are putting in, this will all bear fruits just in a matter of few months. So like you, I'm always very hopeful, and we look forward to benefiting from the overall NIH involvement.
Thank you, John. Any other question? Anybody wants to ask some question? You can stop sharing the screen, John.
Okay.
Yes. Raja, you want to ask something?
Yeah, can you hear me?
Yes, I can hear you.
Okay, I mean, whoever want to actually, due to COVID-19, have you seen any particular problems in eyes in general, affecting eyes? I'm talking about COVID patients.
Yeah, so that's
so I think
actually, actually, I'm pretty sure Dr. Natarajan is a clinician, and Dr. Ravi Goel, they're in a better position to answer such question, and they actually had obviously in their presentation. So let's hold off to that until Dr. Goel is presented, and we can address that issue at the end of the session.
Okay, good. So in the meantime, we'll call for the next speaker. So I'll just show the slide. So can I see the full screen? Can you see the screen?
No, we are still having John's introduction.
I know, but I don't know why I'm not able to show.
You can see your screen.
No, I know, but I don't know. I can see it.
Maybe you should try stop share and then change.
Yeah.
Okay. Okay, yes. I don't know where did it go. Okay. So next, so now I'll show the screen. You can see the screen now?
Yeah.
Yes.
Dr. Pita?
Next, we have, yes. One second. Okay.
You could go to full screen. Yeah.
I'm doing that. So next we have Dr. Pita Rajaman, PhD. the key advisor to the U.S. Secretary of HHS and the U.S. Embassy in India on matters involving health and biomedical research in South Asia, responsible for in-country representation, monitoring, and coordination of the policy, programs, and interests of all HHS agencies over a broad portfolio spanning health policy, non-communicable and communicable diseases, health safety and security, and research and innovation. Initiated research programs and policy at the U.S. National Institute of Health, National Cancer Institute, where she received the Director's Award for exceptional leadership fostering cooperation in cancer research between scientists in the United States and India. Her research on the interaction between genetic susceptibility and environmental factors in cancer has resulted in over 135 peer-reviewed publications. And we all know, as an academician, it's not easy to have so much of peer-reviewed publication. Expert advisory member for various international bodies, including the International Commission on Radiation Protection and the WHO and the Lancet Oncology. Holds a PhD honors in epidemiology from the Johns Hopkins University, an MSc in environmental health, University of Washington, and a BA in biology honors from Reed College. So I'll stop sharing my screen. So, and over to you, Preeta.
Thank you so much, Dr. Natarajan, and thank you to all of you for inviting me to join this really important conversation. So we've already heard quite a bit about the US-India collaboration on vision, which is really one of our most stellar programs. And so I won't talk much about that. I think what the organizers had asked me to talk about was a little bit more broadly, what are the US and India doing in the context of COVID cooperations more generally. And so I'll do that, but of course, happy to answer more specific questions later if you have them. So, just stepping back and looking at this in context, this is a really unusual situation that we all find ourselves in, where no matter who we are, where we are in the world, we're all facing a common challenge. And a challenge, there's really no roadmap, there's no known solutions, and we're all having to figure this out together. In fact, if we look at the numbers just today, there's already more than 27 million confirmed cases. And the US and India are, in fact, the two hardest hit countries at this time. However, what I would like to point out is, yes, we're facing this common challenge, but we're also face this with a common hope. And I would say one of the biggest things that we have going for us is the Indo-US collaboration. And in fact, our ability to work together now on COVID-19 builds on more than 70 years of partnership. So in fact, the health collaboration is one of the oldest, most productive parts of the entire US-India bilateral cooperation. And in fact, a lot of people don't realize that it was very shortly after India achieved independence that some of the first grants and technical collaboration and technical assistance was on health. And in fact, this is a tradition that we've continued. And in fact, over the past 20 years, more than 1.4 billion US dollars in assistance have been specifically towards health priorities in India. So I'll today, obviously the US government has many different agencies, but today I'm going to concentrate on the agencies that are within the Department of Health and Human Services, which we all represent here today. And of course, the three that many of you know very well, of course, our beloved National Institutes of Health, which is well represented today, but also the Centers of Disease Control and Prevention and the Food and Drug Administration, all of whom have a very strong presence here in India. And that's just the agencies, there's another 8 agencies that do actually have investment in India in other ways. These really have the biggest portfolio. And all of us have worked very closely with Indian partners, including the Ministry of Health, the Department of Biotechnology, the National Disaster Management Authority, and many other public as well as private sector partners. So I will say that our long history has been certainly with the government, but very often with private sector partners as well, looking to build systems to prevent, detect, and respond to epidemics, to strengthen the regulation of life-saving drugs and devices, and very importantly, to find the solutions using joint research and development, as you've heard today. So I'd like to spend a few moments talking about some specific examples of how some of our past investments really rolled in when we had to face the COVID epidemic together. We had a question on vaccines, and so it's pertinent that one of the first examples I really want to highlight is a 33-year-old program between the US and the India known as the Vaccine Action Program. And this really has been one of the most successful programs that we've had together, yielding a lot of success stories. Some of you may know that India's first indigenous vaccine for rotavirus, which has gone on to really already save hundreds of thousands of lives, was developed in a partnership through the National Institute of Allergies and Infectious Diseases, as well as DBT and ICMR, the Indian institutions that you know well. And so this framework that already exists has, very easily been used to address the COVID vaccine as well. So as Dr. Prakash rightly said, HHS and NIH, in terms of the research part of it, have been very, very involved in the vaccine development globally. And one of the ways that we've specifically done this here in India is through the Vaccine Action Program, to have a very specific advisory committee that was on candidate vaccines for COVID specifically. And partners from both the US and India, particularly Indian vaccine developers, were invited to come together for this, share some of the details of their program, and request help from the technical expertise, both at NIAID and in the US. And this has been a really, really great conversation. Shortly following this, you already heard of course, one of our research stars, Dr. Tony Fauci, who needs no introduction, actually spoke to a seminar that was organized here by the Indian Council of Medical Research on the importance of vaccines, but also on the importance not only on the development, but on the ethical development of vaccines. How do you develop vaccines so that you're doing them in the most rigorous scientific manner? And how do you ensure that access is equitable after that? So that was, again, a very nice conversation that was hosted by ICMR with NIAID and several other international partners. Many of you, of course, have know our FDA and have probably worked with them or put some of your products through them, perhaps. So they continue, of course, to ensure the safety and quality and effectiveness of food and drug products. But within the context of COVID-19 here in India, they've worked closely with their counterparts here at the CDSCO to look at some of the newly emerging products, certainly sharing what we are authorizing in the US in terms of new diagnostics, new therapeutics. But they've also been working with some of the more unusual ministries for FDA, such as the Ministry of Ayush, in order to help prevent the marketing of unapproved products that claim to mitigate or cure disease when we don't have the evidence base for that. And then finally, when it comes to infectious disease, I'm sure in terms of surveillance systems, etc., many of you know the Centers for Disease Control and Prevention. And of course, they have spent several decades building up systems to prevent, detect, and respond to disease all over the country. And when this epidemic emerged silently, really, in December, CDC here was already tracking it. and I had a sense that we were going to have to come in a major way to strengthen what we already had and deploy that for COVID response. So in fact, the fact that we had hundreds of workers that had already been trained on the front line on contact tracing, the fact that we had people who had gone through the epidemic intelligence service on how to create new surveillance systems, all of these highly skilled people, as well as frontline workers, were very, very quickly deployed into COVID response. And I think even systems that you wouldn't necessarily think of, so we had an active surveillance system for antimicrobial resistance, for example, or looking at hospital-associated infections, certainly of concern to the eye community. Those systems also have been deployed now, not only to ramp up infection prevention controls, but also to, at the same time, disseminate the latest in infection prevention controls specifically for COVID. So I'll stop there for now to allow questions on any of these specific topics. I will just, of course, say there are other institutions such as USAID and our Indo-US Science and Technology Fund that are also funding work on COVID and have also been doing great work. So all in all, very robust program that we have together. We invite any of you who are interested in joining any part of these to please do so. We are open to new partnerships and we would welcome that. Thank you so much.
For the wonderful overview, and we are a few minutes late, but I think we'll have the questions at the end. I hope you will be there. So, and I'll again show my screen so that to introduce the next speaker. So you can see the screen?
Yes.
Yes? Yeah. So the next is Mr. Michael Cheatham, currently with the Fogati International Center from the National Institute of Biomedical Imaging and Bioengineering at NIH, and worked in the Office of the Director, providing expertise on international scientific engagement, strategic planning, and developing new mechanisms to engage external partners. Launched the partnership with Bill and Melinda Gates Foundation on developing a generic platform for smartphone-based diagnostics. Served as editor for the Interagency Working Group on Medical Imaging Roadmap Report. Worked at the American Association for the Advancement of Science as the Associate Director for International Research Collaborations and the Director of the International Science and Technology Partnership Program. While at the AAAS, Cheatham also served as the head of the U.S. Office for the Indo-US Science and Technology Forum and headed the U.S.-India Science and Technology Endowment Fund. 20 years experience building and managing international partnership in science and technology. And with this, I heard in case Mr. Bowman has logged in, I apologize to him for the little delay. So off to you. I'm just stopping my screen. So Mr. Michael Cheatham, you can.
Thank you very much, Dr. Natarajan. And thank you to the organizers. Let me just share my screen here. Let me know when it shows up. This should be a title page. It's really a pleasure to be here. It's been a long time since I've engaged with India on a day-to-day basis, and it's always a pleasure to come back, even if only virtually. I'm going to talk a little bit about the U.S.-India biomedical research landscape. It will build on what Preeta has told you, but a little bit more focused on NIH in particular. And finally, I'll end on some COVID-19 information and some practical advice for next steps. So, U.S.-India technical collaboration, as Preeta noted, is nothing new. It goes back to the to the independence of India, and it has produced some remarkable achievements over the time. So in the 1950s, the Green Revolution through Public Law 480 funds and the land-grant colleges, IIT Kanpur, the first NASA-ISRO collaboration on satellite, deployment of satellite uses. 1987 saw the Vaccine Action Program. Towards the bottom of this screen in 2000, then President Bill Clinton came to India and launched the Indo-US Science and Technology Forum, which was essentially a small binational science foundation with the goal of promoting mutually beneficial cooperation in science, engineering, health, and also education, training, and culture. But this wasn't all. The US-India technical collaboration continues through a high technology cooperation group and a strategic partnership. And in 2005, I've highlighted the National Eye Institute DBT Agreement on Vision Research. It spans agriculture, again with civilian space, energy, security. In 2009, the government's created a Science and Technology Endowment Fund to support early stage commercial ventures, building on collaboration, engineering collaboration. And in 2015, when I stopped working with India on a daily basis, the US-India Health Dialogue was launched, and it continues to this day. This is a highly selective list. There are dozens and dozens of agreements, and the ones listed here are simply the ministerial level agreements. They're certainly not comprehensive, and they don't go down to the individual institutes. So this is a relationship that's both valuable and well known. I could probably stop my talk right here and refer this audience to an opinion piece submitted by the Indian ambassador to the United States just a few weeks ago on August 24th, noting that the very mature US-India healthcare partnership will be a crucial asset in the battle against coronavirus. And again, this is building on our shared priorities and our long history of cooperation. But what can I do to put a slightly finer point on this conversation? I will talk a little bit more about NIH's role in particular and how NIH collaborates with India. So I took a snapshot of India using a tool called World Report. In 2019, the NIH supported 7 grants to a lead organization based in India. This sounds like an impossibly small number until you recognize that there were over 315 NIH-funded research programs that involved Indian research organizations. This is simply an administrative function. Over 186 Indian research organizations were collaborating last year on 176 unique NIH projects. And of the 27 NIH institutes that Dr. Prakash noted, 24 of them make extramural grants. 19 of those 24 were active in India in 2019. So how does this compare over a period of several years? So I plotted using World Report an analysis of the number of grant records involving NIH funding and an Indian research organization starting in 2015. And we're looking at about 200 grant activities. And that number has consistently grown over the years. And I don't yet have numbers for 2020 yet, and the 2019 numbers have not been finalized. So this is somewhat speculative. And the number of institutions, which you can see in the red line, has also grown significantly. The axis on the right is the scale for the number of institutions. It's gone from about 100 organizations in 2015 to almost 200 organizations today. So the NIH is separated by institute, and this is a breakdown of which NIH institutes are active in India over this same 5-year period. I've highlighted the National Eye Institute here. It's in this green sliver. As you might expect, the National Institute of Allergy and Infectious Diseases, much in the news today, and Tony Fauci's institute is responsible for the lion's share of NIH engagement in India. So who are the Indian institutions who are participating through NIH-funded research. And again, using World Report, I've plotted the 60 or so organizations in India that have had 5 or more collaborations with NIH-funded investigators over the past 5 years. And as you can see, the Public Health Foundation of India is number 1, BJ Medical College, AIMS, YRG Care, Christian Medical College Vellore. These 60 some odd organizations are responsible for about 70% of India's engagement in NIH-funded research. So now I will turn specifically to COVID. Sorry, I've lost my screen here. There is a tool publicly available on the NIH website. It's called NIH Reporter. I won't try and give you the web address here. It's a bit unwieldy, but if you just Google NIH Reporter, you will get to this page quite easily. And you'll see at the bottom of the screen, in that red box, there is a filter for COVID-19 response activities. This captures all ongoing NIH-funded grants pertaining to the coronavirus outbreak of 2019 and 2020. There are, as of today, 872 direct awards that have been made in support of coronavirus research. Only 5 of those awards are outside of the United States. Keep in mind, however, that we're only tracking through this small number here, the number of direct awards that are going, and the number of international collaborations will undoubtedly be much higher. So with that, I would leave you with a couple of final thoughts. The NIH funding opportunities, for the most part, are open to all investigators, regardless of country of origin. This is somewhat unique, as Dr. Prakash has noted, and is very different from the U.S. National Science Foundation, which exists only to support the U.S. research enterprise. NIH funds the best science wherever it comes from. I would emphasize, and I could not say this enough, do not rely on the establishment of an institutional partnership or an institutional agreement to establish a collaboration with NIH-funded researchers. Most US-India collaborations are initiated by individual investigators and are done so in the absence of an umbrella agreement between the institutions. There are many examples of agreements between US and Indian institutions, but they are not the only avenue for promoting collaboration. So my practical advice is use the NIH Reporter or World Report, and you'll see the URL for World Report, which is my platform down here, to identify relevant research activities and potential partners for research from Indian institutions. And I would note as a practical measure that partnership with a US investigator greatly increases the likelihood of success. So I also just want to take a moment to put COVID-19 research response in context, in a broader context, and call your attention to a project tracker created by the UK CDR and GLOPIT-R groups. This is a platform that the NIH participates in. They are both tracking research activities pertaining to COVID-19, as well as cross-referencing them with the WHO priorities for coronavirus research. There's a rather long URL down here that you can capture on the slides, but you can also Google UK CDR GLOPIT GLOPIDR COVID research tracker, and you'll find this page, and you can interact with the data here. With that, I would leave you with my commercial consideration. This is World Report, which is a public database supported by the NIH in partnership with 12 funding organizations. You can see their logos down here on the bottom. And what we do is we track research supported by those organizations and the global research networks that ensue based on that research funding. And we literally put you on the map and connect you to the map. In the top left here, you will see some of the uses we have for World Report. It was created as a coordination mechanism among funding agencies, but we've noticed it also has other discrete uses, including what I mentioned earlier, partner identification. we're really interested in learning how you use World Report and how we can improve it. These are some suggestions we've received in the past. I would welcome your feedback. My email is at the bottom here. And with that, I would give back the remainder of my time and save it for questions at the end. Thank you.
Thank you, Michael. Thanks a lot. We'll have the questions at the end. And we have the most awaited, my friend is here. So I'll just share the screen for a minute so that you can see the screen.
Can I just welcome Mr. Boman Irani?
Yes.
Hello, I'm Rajalakshmi Rao here. We've met earlier many times, but today especially we chose this day because it's the last day of the 2-week program of I Donor Week by Government of India. And you are one of those not only most endearing actors that we all just love, but I've heard you in Rotary where you talked about your own life, humble man and a social activist and a man with love for people, and that's what made him come today for this, besides being requested by doctor, but at heart you believed in it, and to propose, donate vision to people. I think that's your goodness, and believe me, not only the participants who are coming today to hear this, but the panelists are all your fans. They all want to give you some Jadoo Ki Jappi and all that. They're all excited about you. And thank you very much, Mr. Boman Irani, for joining. And you made Indo-American Chamber very proud that you have given your time to talk about donating vision to people. Welcome to this program.
Thank you. So, Raja, you can see the slide, right? So you can see the slide, Raja?
Yes, yes, yes.
Okay. So I just took only 1 second. That is, we are in the Government of India celebrates this fortnight as eye donation fortnight, 25th August to 8th September 2020. And this is the 35th, that means 35 years Government of India is promoting National Eye Donation Fortnight. Give the gift of sight to those in need. And none other than women who's here to help us to do this campaign, which aims to create mass public awareness about the importance of eye donation and to motivate people to pledge their eyes for donation after death. The reason is nobody can donate their eyes, they only can pledge the eyes. So that's what I want them. I want everybody to live and Bowman to live 100 years. So Bowman is a Parsi family, and I graduated at Mithibai College, and he's my neighbor. And I realized it because I started my career in Dadar, and he also lives here. And in a way, I came to know through him only that he's my friend and I've known him since 1988, that the year I came from Madras to Bombay that time. Now it's Chennai to Mumbai. He pursued a career initially with Life Insurance Corporation of India from 82 to 85, and simultaneously also established an Uncle Chips franchise. His expertise was more of British theatre, and he soon developed fantastic accent, and he has over 40 plays to his credit, around 15 of them as the lead character. Started out in a number of advertisements like Fanta, Seat, and Crack Jack biscuits. He made his debut with the 2003 anthology horror film Darna Mana Hai. Munna by MBBS, everybody knows. That's why our John Prakash wants to give him a virtual Jadoo Ki Jappi. His role as Jayasthana was one of his most memorable, and that's why whenever Bowman comes to the clinic, he always acts as let us act, he will say, and he's a great human being. And Bowman is a member of the Parsi television actors community. He launched his production house, the Irani Movie Tone, in the year 2019, and recipient of many awards: Munna by MBBS, Lagero, Munna by Three Idiots, Shirin, Farhad, Keto, Nikhil Padi. So I think the most important, which I want to tell, is which I learned from him on the 1st August during our 30th anniversary, where he actually told, sorry, during the 30th anniversary, I came to know that he was actually started his career as a serving in Taj, and he said, when first report he said is, he was asked to go to, he asked me, where do you, the manager asked him, where do you like to go and serve? He said, I want to go to the top rooftop restaurant, and which is the 16th floor. Everybody knows Taj Mahal Palace Hotel, but he said, no, first go to the basement, go and learn everything. So he says For going up in life, you have to go down to the basics, and I think his basics are strong. And you should all see his YouTube, his own thing, which is a motivational speaker. And now and then I attend the cine. He's now doing cine play classes. Anyway, he keeps. He doesn't keep me there because he doesn't want to be his student. Anyway, I'm not going to be his competitor. And now, without taking much time, Bowman, all yours. I think you have to unmute, Bowman. You have to unmute. Yeah, there's a still Trupti, can you help? There's a green button, small green
Yes,
button,
I'll
which
try.
will be.
I'll try.
Yeah. I should say, Bowman is the most looking most smart today. And
We still can't hear him.
still you're muted, Bowman. I think there's a green button, small microphone green button above the television icon. Or maybe I will just take a picture.
So I should actually say I was having trouble as well, and I had to reboot the computer in order for that to work. So that might help.
I'm just sending a screenshot to him. Bowman, I sent a screenshot. You can see my screenshot. I've sent a screenshot in the WhatsApp. So there's a small Trupti, is it possible to help him?
I'm trying that only. Just give me a moment.
We are not able to hear him. Bowman, I'm going to call you.
Mr. Irani, you have to reboot your system, and then I think you'll be able to we'll be able to hear you.
Yeah. Okay. So I think they are saying to reboot. You're able to see the screen with the.
Can you hear me now?
I can hear you.
Yes. Yes.
We can hear
Yes.
you now.
We can hear.
Wow.
Great.
Wow.
Oh, what a genius! What a genius! I have to say, it gives me great honor. It's great. I don't know what I'm doing on this panel, honestly, but I'll say this: my mother always encouraged me to be an actor, and follow the performing arts and what have you. But my uncle always wanted me to be a doctor. And I said, there's no way in the world I can be a doctor. I don't have the wherewithal nor the academic leanings to be a doctor. So, but I told him, but one day you watch me, I'll sit with a hell of a lot of doctors and that'll prove you wrong. So here I am on this wonderful panel. And also, another thing is, I told my uncle, one day you will see me with a stethoscope around my neck and I'll be a doctor. And sure enough, you all don't know this, but I played a doctor about 12 times in movies. So, well, that qualifies somewhere or the other. But that's on a lighter note. I'm glad you can all hear me now. I am very, very honored to be here, number one. And I just want to say, Dr. Natarajan, would you like to nudge me into areas? Because there are a few things that I need to say, but I need you to help me here. You were talking this afternoon about the incident that took place in my family. Yeah. You want me to talk about that?
Yes, that's right. So that's the incident, I think, which everybody will be happy to know. And it's a real, Raja, I think it's a great story. It's a real story. It's
I'll tell you what happened. My Dr. Natarajan used to treat my mother about 30 years ago, and that's the time I met him for the first time. And I didn't meet him for the first time. Actually, my mother and my sister went to him. And I just want to bring the story to up front because it's important. And doctors somehow. The first question I asked her when she came home, how was the doctor? She said, doctor was great. I said, did he speak to you well? And he treated you well? So he says, he treated me like I was his own mother. And I think it's very important. It's very important for me to put this out there, that my connection with him is simply starts with that small little act of kindness. You will all agree. Many years later, a cousin of mine passed away, and there was pandemonium, as there is in such tragic times. And we were at the place where he had passed away, and we were on our way to the Towers of Silence, and we were driving down, and somebody in the car said his wish was to donate his eyes. And then somebody else in the ambulance said, but how do we do this? No, 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 no. And the wife is hysterical and she's really, really cut up. It was also sudden. It was so I said, look, I don't know what to do. Saying, do something. And I really don't remember. Dr. Natarajan remembers it even more vividly because it was a rare case in that sense. I said, let's turn the ambulance and go to Dr. Natarajan. I remember Dr. Natarajan as my mom's doctor. So I called up Dr. Natarajan and he said, come here. Normally you go to the person's house and get, remove the, I don't know how to say it correctly and politely, but he says, you'll have to come to the Aditya Jyot hospital. We went there and that happened. It was all, I'll tell you why I'm telling you this story. I'm telling you this story because in times of such tragedy, I think families are dealing with the tragedy. They aren't quite dealing with the nitty-gritty of doing things that people may have said on a particular day that, I'd like to donate my eyes and other organs. But I think it's very important for us to stress to families. It's not the nicest thing to stress at times like this, but someone in the family will have to take charge of a situation like this, because it is so important that a wish of a person, a dying person, has to be fulfilled. There is confusion. There is people are distraught, but someone will have to take charge. I don't know whether it was me. Dr. Natarajan says it was me. I don't believe it because that's not me. And people like me will have to learn. But I'm so glad that it happened for the soul of that cousin of mine. And I think apart from saying that, we got so many sign-ups and we need how many 3 lakh donations per year. Am I right?
3 lakhs a year.
Right.
Yes.
And we end up getting about 40, 50,000.
That's right. That's
right.
right.
So
yes.
I think, and this is my little Annadi Bheja talking over here, that you may have people may have promised their eyes when they were living, but how do you convert that number? Because they are not there to see it through themselves. So I think that while a person says, I am very happy to donate my eyes after I'm gone, but I have to assign some young person to see it through as one of my dying wish. I'm sorry, I hope I'm not sounding very crude and heartless when I'm saying all these things. But this is what the point I want to get across, that had somebody not taken the initiative and called up Dr. Natarajan, maybe I just made the call, but I was distraught myself. That one eye donation may not have happened, and it goes a long way. I mean, you people do such wonderful work. I feel actually embarrassed to be on this panel with such luminaries, and the way you are speaking, I've been hearing it for some time now. Not that I understand most of it. I understand just 98% of it. The rest of it goes over my head. I'm joking, of course, Dr. Preeta. But the point I'm making is, from a simple layman, that maybe it's this psychological angle that one has to stress upon, not just the quotidian of getting it done. It doesn't sound that ordinary and simple. It is not. It is not. Getting people to sign up is difficult, but getting to follow it through is the difficult part. So I said my piece, Doctor.
Yes, thank you, Bowman. I think that's the real thing which we wanted. That I remember when Sharmila Tagore came to inaugurate an eye bank in Lower Parel, she also said the same. She said by the time my father died and she was old and he died of cancer, and then he willed to donate, but they forgot to call the eye doctor or eye bank. So I think it's a very well point, and I think the incident which when Bowman only called me, I think somehow he's very modest, but he only called me and he asked me, what do I do? Because we want to, already the time to go to the Tower of Silence, and then what do we do? And I said, okay, it's unconventional because we don't have in a living hospital, we don't get I'm also crude, we don't get a person after their death into the hospital, because my hospital staff were very worried when I told them, how can you get I'm sorry to say that they get a dead body to the hospital. But I said, no, here is not only a good human being, a famous human being calling me and asking me, can you take the eyes? And if you say you can't do it, and what else we can do as an eye bank? I think it was also a holiday, I think, probably a Sunday afternoon. And then I said, we did it. I said, Tower of Silence is in the, from peripheral Mumbai to the South Mumbai. And I think on the way, if the stretcher was brought in the hospital, in the veranda, we did it, because in the house also we do the same. And the same thing we did in the hospital. And I think I told them, we are doctors and we are dealing with the human people. And I think we have to be. And thank you, Bowman, for remembering that, and also remembering about your mom. And really, my regards and blessings. And we have John Prakash from US, Ravi Goel, Michael from US.
Just one last thing before I go, that I'm utterly grateful for all that you do, all of you, and I feel humbled to be in your presence. So, Dr. John Prakash, thank you very much, all of you.
We want to give John
Dr. Peter, so lovely to hear you all speak. I won't be. I got to.
You gave us one line. All of us pledged actually our eyes, but we never thought this through, that we have not told our family members clearly that you must remember this at that time. I'm so glad you brought it up. That is a practical reality check you gave. I think all of us must now keep talking about that as the point two. One is to pledge. Point two is ensure that pledge is a reality. Thank you so much for putting it so correctly.
As soon as anybody dies, I think they should call the doctor for death certificate, take care of the will. But the important thing is to call the eye bank, because within 6 hours we have to remove the eyes for harvesting it for the eye donation. Thank you, Bowman. I think, John, you have to unmute yourself. You're muted. Yeah. You wanted to say something?
I want to do it again. No, I'm here as I am.
Sorry. Right. No, I'm asking John Prakash. John?
Okay.
No, you're muted, I think. Can't hear you. You want to, so I want to give a flying kiss. Thank you, Bowman. Thanks a lot. Thank you so much.
Thank you so much. Thank you so much.
Thank you so much.
Yes, great.
Dr. Ravi Goel. Yes. Bye-bye. Bye.
Bye.
Bye, sir.
Thank you. So great. I think you brought out an excellent point. Now I'll come to the final speak to share my screen again. Oh. Where is the? Yeah, show my screen. So you can see my screen, right?
Yes. Yes. Yes.
So next we have the final speaker is the most handsome man here, Dr. Ravi Goel. He's a comprehensive ophthalmologist and a cataract surgeon, regional eye associates, Cherry Hill, New Jersey, USA. He's a board of trustees of American Academy of Ophthalmology. And I want to say it's not easy. And not only that, American Academy of Ophthalmology is the largest society in the world, which attracts about 30,000 members. The only thing is it's an annual renewal membership, which I'm a member for the last 30 years. And also the All India Ophthalmic Society has 23,000 life members. And that's the difference. Here, every year, each member has to pay and then be a member. And I think everybody is proud to be part of American Academy of Ophthalmology, and is doing a lot of advocacy as a part of American Academy of Ophthalmology, and I love attending it, and I'm actively part of it in various roles. And he's also the vice chair of AMA Ophthalmology Section Council. And I learned a lot from Ravi, because being associated with him, I think even during this rubber bullet injury which happened during this few weeks back. So I think I'm glad he brought out what happened in 2016. I was in the New York Times front page for opportunity for doing a good service in Kashmir, which Raja mentioned. Because now world over, yesterday we had a speaker who spoke about Chile, that blast injuries happened in 2019 October, and we also have in Middle East. So I think Ravi, to you, and I think we are very happy that All India Ophthalmic Society and American Academy of Ophthalmology work together. It's not a part of the Indo-American collaboration, but it's between two societies, and I'm happy we have had several sessions. Over to you, Ravi.
Dr. Ravi, you have to unmute yourself.
I think that's the code word of 2020. You have to unmute yourself. You know. Can you hear me now? Thank you. I'm going to speak about. First, it's hard to follow the previous speaker, Mr. Bowman, but I'm going to speak about the compassionate practice, collaboration, and emotional intelligence post-COVID. I have no financial disclosures. This is what we're used to. We're used to attending meetings, whether with the Chamber of Commerce or with ophthalmology or cross medicine, in which large groups of people gather and we have collaboration and networking and the opportunity to learn from each other and to be together and to advance the professions. This is what life has turned into, at least for 2020 and probably for 2021, where now colleagues around the world are going to be meeting online. This is a recent screenshot from the American Academy of Ophthalmology Board of Trustees meeting, where we all look like we're in our bunkers trying to advance medicine, trying to advance ophthalmology. As we've gone from being from gathering together to going online, we've had the opportunity to learn online, but we've also experienced something called the sea of sameness, where we're starting to lose the elegance of learning through so many Zoom online webinars, etc. My talk today will be to help give some high-level points on optimizing our practice and optimizing our profession, and through collaboration between physicians and the Chamber of Commerce for practice optimization. You know, we used to be able to gather in our offices and meet together, and now many of the companies that are advancing are bringing about changes online and providing resources to their physicians and resources to the practices. It's no longer what can I teach you, it's what do you need and how can I respond? How can I help you become successful? So one thing that I do, I work on ophthalmic practice, and we've created these modules to help practices in ophthalmology, but which can be expanded to help develop something called resilient leadership. Resilient leadership, financial resiliency, and also, as was pointed out with the previous speaker and Dr. Natarajan, focusing on the patient experience and practice culture. And as COVID-19 has shown, creating disaster planning going forward. These are modules that my team has been working on. Surgical facilities and PPE. It no longer is that representatives and surgery companies or pharmaceutical reps can come into the operating rooms any longer. Now all PPE is essential. So essential workers, they can travel, but everybody else has to go home. So this has created new opportunities to create online learning and teaching. Here you see a picture of me teaching one of the Wills Eye residents. This is before COVID-19, so we were not wearing our masks. But now we can go to mobile learning and using FaceTime to teach pearls to our students. Innovation. The hallmark of meetings is those spontaneous interactions where colleagues are able to come together and create innovation, sort of throw ideas out there, try to help and try to move our professions forward. I think that's one thing that's been missing since the onset of COVID-19 and social distancing. But I think hopefully we'll be able to figure out ways to move forward on the issue. I look forward to the Chamber of Commerce offering us possible solutions to get us there. Networking, as I've mentioned, has gone from in-person to moving online. And now if you have virtual meetings between industry, ophthalmic industry, pharma industry, and physicians, we can figure out new ways to give physicians or give professionals information that they need during this time of the COVID-19 and social distancing. We've seen that pharma companies, at least in the United States, have increased the amount of their digital spending for digital ad spending since March, and you'll see that a big jump up as they're trying to reach physicians where they are, reach healthcare providers. Finally, I want to mention the issue of emotional intelligence. You know, like I think that we lose something when we're not in person meeting with each other, But I think that there are still, so this actually hurts younger folks who are just starting out in their industries, or starting out in pharma industry, or starting out in practice. But hopefully we will find new tools to better engage with emotional intelligence on that individual level. Finally, I'd like to mention a great TED Talk by Abraham Varghese, the author, referring to the doctor's touch. And I think that there is this ritual of medicine in which we examine a patient in a certain order and in a certain manner. I think that there is still this ritual of the doctor examining the patient, touching the patient, and helping that patient move forward and helping them to protect their life, protecting sight and empower their lives. And during one of the earlier talks, someone asked about COVID-19 and the potential for eye disease. But there are two case studies that were just published in JAMA Ophthalmology last week. So I did add these slides in the last half hour. But this is a nice timeline of two cases of conjunctivitis in mobile clinics, where they had one of the patients had 93 samples per milliliter, and 50 or more samples per milliliter is considered positive for SARS-CoV-19. With that, I want to thank you. I wanted to make this talk brief, given the lateness of the hour, but I am on Instagram and Twitter, and I do have a blog, protectingsight.com. And with that, I'll leave the time open for questions.
Can I ask you something, Dr. Ravi?
Yes.
Yes.
Tell me, I asked the same question about COVID-19 effects of that for a positive patient in the eyes. They may recover from COVID-19, but what are the changes in their eye? Anything that you all noticed which is significant that may affect in long run that they should be aware of? It should not be a surprise.
I defer to Dr. Natarajan on that one. So I think.
So, Rajay, that's a good question, but I don't know whether anybody knows the history. In October 2019, the first doctor who reported COVID was an eye doctor, and he died in December. And his parents got corona, and fortunately they have survived, but he died. And his Win Lang Lee is his name. And the American Academy of Ophthalmology has made an obituary, and because you know the history. And then after that, they found that the coronavirus can enter the body through mouth, nose, and eyes. That means any mucous membrane, it cannot come to the skin. So that's a good thing about corona. That's why the 3 SMS works. That is, I as a president of organized medicine are propagating 3H to SMS. 3H is happy, healthy, holistic life. And then with the SMS is, you have to do sanitizing, social distancing, and mask. So the other affection which is there, once the corona comes, it produces thromboembolism. That means like a heart attack, which affects the blood vessels, and also inflammation of the blood vessels. So unfortunately, retinal blood vessels are now reported, and we saw the first patient a few weeks back. We are in the process of publication. There are some publications already come. So it produces occlusion of the veins of the retina. That means the patient, in layman's term, they suddenly lose vision without symptom also. So we want to tell the whole world, if you have a vision problem, please don't neglect. Go to the eye doctor, and if the eye doctor advises you to do a COVID test, get it done. Because people think all these problems, if you see in the newspaper and TV, at least in Mumbai, sometimes they think the doctor is doing over test. But I wanted to tell that COVID can affect the retina, because of it, not in all, some of them. So it produces artery occlusion like a heart attack. It happens retina attack, and you can give they have to give anticoagulants in consultation with the physician. So the eye, and apart from that, few of them get conjunctivitis. That's the report which Dr. Ravi posted it, which is the one part of it. So if there's a conjunctivitis, again it can be a regular conjunctivitis, or it could be any viral or a coronavirus, which is also viral. So I think fortunately that does not produce vision problem, but a retinal problem produces vision problem. It can result in total blindness also. So we have treated. So in April, I was hesitant to start treating patients, but now I am treating directly my other retina colleagues, where we wear PPE. So if it is a retinal vein occlusion following corona without fever, without any other symptom, only having eye problem, and then when you do a corona test, it's positive, or you do an antibody test, I think we have to treat, and anyhow, if it is only antibody and no symptom, no treatment for corona, but at least the eye part should be treated immediately. And that's what I think. Yesterday there was a publication in Times of India, in a doctor reporting in Ahmedabad, and somebody reporting 3 days back in Times of India also.
Thank you so much, Doctor. I mean, it's a very well put. Now at least we understand.
And also, U.S. government had advertised through the federal government and also the Indo-American collaboration, not for ophthalmology, but anything, where they also asked for a research grant for developing something on COVID. Anyhow, we applied, as John put it, and Peter knows also that it is goes through a peer review. That means equal research scholars go through and see, and it's a competition again. And I think so many institutes apply. I think some have got it. We didn't get it, but we don't give up. We keep writing. The idea is to do something new, and everybody can contribute for this corona.
I think, hi, Dr. Natarajan, there is a question from one of the participants. Is there anything we can identify from eye retina images?
Yes, actually, there's only one report from fundus photo and OCT. The first report from Brazil, which is published by my friend senior Rubens Belfort, where they found some cotton wool patches on the retina. That means that shows ischemia. What is ischemia? The blood circulation is affected, which is seen in diabetic patients and blood pressure patients. So here also in COVID, some of them get it. So and we are doing the second largest trial, not a trial, sorry, it's an observational study, second largest in the world, where we have examined 60 patients of COVID with retina photographs and a test called optical coherent tomography to see. We are also applying with the technology of using AI with our colleague researcher in Singapore, from the Singapore group, and with another AI company in based in Calcutta, the retina doctor in Delhi. So with all the peer, what we call the institutional review board and the ethical committee approval, with the ethical committee approval from the Messina Hospital, we have done that. It's an observational study. That means we are not doing any trial. We are examining the patients without putting any drops also, using without drops. We can examine the retina, and we are trying to correlate. The idea is not to scare public. We want to tell early detection. Doctors can help the patient to see well, or if they're losing vision, we can prevent them going blind. You're again muted, Dr. Radhika. You're muted.
Okay. Thank you, Dr. Natarajan. I have two more quick questions. One is for Mr. Michael Cheetham and the other for Dr. Gyan Prakash. First is for Michael. Is it possible to implement artificial intelligence on these retinal images to come up with something? I mean, this is a question from the participant.
I would defer to Dr. Prakash or Dr. Natarajan on that particular question.
Okay.
Michael, I think I wanted to say, Gyan knows it, the most extensive AI work is done by Google, but still they have not come out with a product. So because my personal interest to work on AI, so thanks to Dr. Radhika and my other colleagues, Dr. Asta Jain and Ashwini, and also the software company called Meteos, which is bought over by an Indian company, Remedio. We have done the first publication on JAMA on August 8th, which says using offline artificial intelligence to diagnose retina, the retinal pictures in diabetic retinopathy. Same thing we're trying to do for COVID also. So I think AI will have a definitely, and Sundar Pichai has made a video which is there, where using the same retinal picture, analyzing the blood vessel configuration in the retina picture, using AI, we can predict ischemic heart disease. That means a person may go in for a heart-related issues can be predicted by AI. But it's a long way to go. But at the same time, and even if AI comes and there's a lot of worry between, I think the public also, it is not going to be automatic. Yesterday, I was having a dinner and she's an 11th standard girl and she was asking, her parents are asking, oh, in future she wants to be a doctor and now AI is going to come. And if AI comes, what is the role of a doctor? I said, but behind AI and behind the technology, the doctor is required. And I'm glad the last slide of Ravi Goyal put it, and even our Boman Irani has acted. And the real thing, which he keeps reminding me, is like I didn't even know that he checks about the doctor with his mother, and I think you know have a hair raising thing. We have to do compassion and medicine. And that's where I want people to know. Dr. Abdul Kalam gifted a book by the first Dalai Lama Rinpoche, Compassion and Medicine, and that's what I think Ravi Goyal spoke. So I think as a doctor, whatever AI is there, offline AI is there, and as I mentioned about COVID, we're using teleophthalmology. AI will have a place, and even though there is a autopilot in the planes, and now I think there was a joke that we cannot work from home. So I think the same. As a doctor, we have a limitation to work from home to treat eye patients. We can treat cough, cold, and something, but not an eye patient. But eye patient has to go to some doctor and get a tech or an optometrist or eye care professional and get an eye photo done. And that's where my contribution as the president of All India Ophthalmic Society is train people without education, which we have a lot of in India, but with brain, where they have intelligence. That means they don't have they have normal intelligence. And thanks to Dr. Radhika, who has implemented my idea, we have trained 3 Maharashtrian people.
Dr. Natarajan, there are sorry to interrupt, because there are 3 more questions. I will just quickly get to them. Dr. Gyanprakash, yes. I think this is from somebody who is interested in funding. Is the time period for any COVID-19 grants, is it shorter or does it take the usual time? You're muted. You're muted.
You're muted. No, Preeta, you can answer. I think it's John. You can see something. No, we can't hear you.
Again, you're muted.
No, you're muted still. Again.
Now we can. Now we can.
So I was muted by the organizer actually. So because I talk, okay. maybe I talk too much. So, but in it.
No. The question was that whether the funding for these COVID-19 grants that you talked about, whether they happen faster or do they take the usual time?
So there are actually the Indo-US program. I don't know what context the person is asking about. Is the Indo-US program? It has a deadline and it has the timeline, the usual timeline, which is about 8-9 months process for NIH. But there are actually COVID grants, not specifically eye related, but one could show eye association things that Dr. Natarajan discussed. One can go and apply for those programs. So NIH has multiple programs, multiple grants, multiple things that are going on. And I would basically refer the person to the NIH website. It's not just and I'm sure Dr. Preeta has more information if there is anything specific for India. But clearly there are a number of programs that are going on at NIH. A person is referring to the DBT program, it is going to have the usual timeline. Dr. Preeta, you have any?
Yeah, so I'll just add. Sorry, I'll just quickly add to that. In terms of. Yeah, there are some specific India programs. I think certainly through the Indo-US Technology Forum, there was a number of calls that were very quick review, just a month actually for COVID. And also there are supplements for COVID to existing grants that are also coming through quicker than the usual.
Yeah, very good. Yes.
Okay, thank you.
And you had a comment?
I was not wrong, John.
Do we have time for one more question? Okay, so this either Dr. Ravi or Dr. Natarajan. So the question is, can eye symptoms be the presenting feature of COVID in absence of any fever?
Ravi, you'd like to take the question?
I mean, you're so much more comprehensive. I think you could have. I think that this is the big challenge in the United States, and I'm sure in India also, is that you can have asymptomatic COVID. You can have COVID without fever, and then you can infect your family members, unless I'm mistaken on that. I haven't seen a case. Dr. Natarajan?
Yeah. So here the question is, can eye symptoms be the one, without any other COVID symptoms?
Yeah, I understand.
Yeah, the first patient which we are reporting maybe the first in the world is that one, because the mother had COVID fever, but the daughter did not have fever. But the father was intelligent. He himself got the COVID test done. Anyhow, the problem is they didn't tell us. And when we saw the eye, we asked asked more questions. And I told, because I don't want to reveal my age. I told 60 plus. I don't want to see you. Then she came out with no, I have a retina problem and this and that. Then we made Jaydeep do it. So the answer to the question is it can report just as an eye symptom without anything. So that is where it doesn't happen commonly, but it can happen.
Okay. Thank you. Thank you very much.
So I think now the questions are over. And so I was not wrong, huh? Dr. John Prakash. I mean, you along with, of course, the players who will look into these grants and all that, you, Preeta and all, and Michael, Ravi, I think you all can really look into all these grants and all that. That's why I told all the participants to hear all your, whatever you're saying, carefully, because you never know. Luck may just turn around and you may actually grant after looking at the application they give. So you are powerful. So thank you very much for coming on this webinar and telling everybody what you're all doing, because we don't know what's happening. And you opened some of those aspects of how you're helping in research. And each of you are doing such wonderful work. And I'm having something with US FDA on the 24th. We're speaking to Indo-American Chamber, so on pharma issues. And so we're connecting again. And I think at the end of it, I mean, the biggest thanks to all of you, but I think vote of thanks, I must ask Dr. Radhika Krishnan, who has really put in all this effort. And she's a director and advisor in Aditya Jyot Foundation. And she has done a lot of work along with my team, with Trupti and Kamal Vora and Sagar, who are actually connected right now. They worked a lot for this because we did it in a very short time. So literally within a week, we put it together. I truly appreciate for all of you having said yes to this. But of course, it is for love of Dr. Natarajan, you've said it, but also for the cause you've given this time. And I'm extremely grateful to you from Indo-American Chamber of Commerce. Now I request Dr. Radhika to say a few words of what.
Only 1 second. I just want to say, in addition to what Raja you mentioned, American Academy lots to learn. One of the things is about medical care or ophthalmology care which we are giving to the patient. But other than that is they have a separate portal, which is what I'm trying to recommend in All India Ophthalmic Society. Sometimes they say, why do you want to copy? But I said, doesn't matter. Good things have to be copied. They have a separate patient portal in the American Academy, AAO.org. And it looks like I'm a spokesperson for AAO. I don't mind. But anyway, they don't allow me. He's a board of trustee. But I think I'm a part of some of the committees. But I wanted to say thanks. I know every time I see the disclaimer note by John, Preeta, and all of you from America that even Ravi says whatever I say is not part of the academy. But I think academy has got a fantastic thing which I think Indians should learn, where they're allowing patients to write about whatever their experiences and good, bad. But I think finally, just because the patient goes blind does not mean the doctor is bad or the surgery is bad. And that's what I think I want to convey as a last part, which thanks to Ravi for always supporting. Thank you, Ravi. You're one of the most energetic ophthalmologists of the American Academy. I'm glad you're a trustee and we want to do more.
Thank you, Bhai. Thank you, Bhai.
Let me quickly propose the formal vote of thanks. It's always a pleasure thanking people, and I will start with Rajalakshmi. Thank you so much, because as soon as I suggested the idea, you took it up, and I hope this was beneficial to the members of the Indo-American Chamber. And I would like to thank the entire team, the software guys and everyone, Trupti, for putting it together. And Dr. Gyan Prakash ji, thank you so much, because you immediately agreed, and not only that, you guided me on putting it together. So I'm really grateful, and we thank you very much for that. And it's because of you that Mr. Cheetham agreed immediately. I mean, thank you, Michael, and thanks so much. I would like to say that I learned of a new avenue for grants. I've written it down for my team so that they can look it up. Thank you very much for that. Thanks, Dr. Preetha. It's good to know, and we are very hopeful that with the Indo-American collaboration, hopefully there's something that's going to be good on the horizon as far as COVID is concerned. Thank you so much for your talk. Dr. Ravi, a very emphatic and a very, I would say, a lot of patient-friendly language which comes in from your slides. Thank you, and I thank all of you from the US who've gotten up early in the morning to be with us. From our team, I would like to acknowledge Sameer and also Mr. Anil Nair. Thank you very much, and thanks a lot once again for all of you who have tuned in to watch us, both on our also on the Facebook and the YouTube pages that we are streaming on. Thank you.
Thank you so much. Thank you all, and it was really a great pleasure. So,
Have a good day. Bye.
Anyway,
Thank you.
yeah, bye.
Thank you so much.